to start with is how your heartbeat is regulated. So what controls the beating of your heart? So that you know, your heart has what we call a built-in conduction system. When we're talking about conduction, we are talking about electrical activity. And so we are literally saying that there are things in your heart that conduct electricity, and these electrical signals are the thing that regulates your heartbeat. So when we look at your heart, there are a couple of spots where we have a piece that's particularly important to the regulation of your heartbeat. First, we have what is called your sinoatrial or SA node. Now, when we look at your heart, your SA node, like it says here, is in the upper right corner of the right atrium. So your sinoatrial or SA node starts each cycle. It sets the pace. So sometimes we call it the pacemaker for your heart. And it's located in the upper right corner of the right atrium, which on a picture actually looks like the top left, because the picture is always the mirror image of the heart. So we have your sinoatrial node, which is often referred to just as the SA node, starting each cardiac cycle. Now what happens is that this node receives a signal. Now the signal comes from your brain, and we're not going to follow the pathway all the way up there. We'll just start with your heart. But your sinoatrial node receives a signal, and then it sends the signal on to other places. So if you take a look, the sinoatrial or SA node causes two things: the contraction of the atria and it stimulates the next node down the pathway. People very frequently will ask me, what exactly is a node? A node is like a collection of fibers. These are nerve fibers that are stimulating the muscles in your heart to do something. So your sinoatrial node stimulates your atria. There are, and you'll see it flash yellow because this is animated, which is awesome, but you'll see it flash yellow up here, and if you follow this, you'll see that this node is connected to a bunch of spots in both your right and your left atria. So when the SA node is stimulated, it sends a signal through muscle fibers to both of the atria, and it tells them to contract. That pushes blood from your atria through a valve to your ventricles. It also stimulates the AV node, which is the next collection of nerve fibers down the pathway. The AV node is shorthand for atrioventricular node, so it's telling you exactly which two things it's connecting, the atria and the ventricles. Now this node stimulated the muscles of the ventricles to contract. And the way that it does this is through a really, really large nerve fiber. So when we look at the AV node, it's right at the cusp between the atria and the ventricles. So on a picture of a heart, it kind of looks like it's in the middle. And you'll see that there's this really, really, really long nerve fiber. The nerve fiber is called Purkinje fiber, and it descends sort of from the middle down and around each of the ventricles. And then it branches off further from each of those spots. The very beginning of this long nerve fiber is called the bundle of His. I know these things have really awesome, fantastic names. Purkinje is how you pronounce the fiber. Bundle of His is how you pronounce the beginning of that nerve fiber. So if I were just to sketch out just what the nerve fibers look like, I have a bundle at the top that branches out, a bundle in the middle that spreads out kind of like a fish hook. That's how it looks to me anyways. But that's the basic setup of the nerve fibers that run through your heart, and that is where electrical signals are being passed. Now the other thing that I need to mention here is how we actually measure this. So unless I can physically see your heart and see electricity, which, let's be honest, you can't usually, I need something to record what's happening in your heart so that I can tell whether or not all of these things are happening. So an electrocardiogram is the measurement that we would use to assess this. So in this section today, we're focusing on not only how your heart works, but what tools I can use to check if that's actually happening in your heart. So an electrocardiogram, which is very often referred to as an ECG, you might hear it called, depending on usually the age of the people, but sometimes it's called an EKG. This is for versions where we spell cardio with a K because we're basing it on the Latin word instead. But an ECG, or sometimes in older terms EKG, they're both talking about the same thing. An electrocardiogram, which is a printout of the electrical activity of the heart. In other words, the activity of the SA and the AV nodes. Now I put one little picture here, but what I'd actually like for us to do is to take a look at page 275 of your textbook. So when you're done writing, could you please, it would be realistic for me to ask you what's happening to make your ECG look the way it was. I would not ask you to memorize how high the line is supposed to go or how long it's supposed to last. So for example, I don't need you to know how many millivolts this is or how much time that represents, but it would be realistic for me to ask you, hey, what's happening here at point 1, the P wave? What's going on? What's contracting? What's being stimulated? In the whole QRS section, what's happening? Well, that's where your ventricles are contracting. And then finally, the T wave at the end, that is when the semilunar valves, the second set of valves, is closing. And so I could ask you in general terms what's happening in your heart in each section of an ECG. Would anybody like to ask questions about any of the vocab, or does anyone need this screen to be up still? Okay. So our next topic, which is closely related to that one, are your heart sounds. So tomorrow we will go to the lab for part of the class, and one of the things that you will do is listen to your heart and other people's hearts beating with a stethoscope. Not a cheap, I bought it in a doctor kit to play with stethoscope, like a real doctor stethoscope. They're high quality. It will hurt your ears if someone yells in it when you're wearing them. But your heartbeat consists of 2 sounds. Now I mentioned earlier that the 2 sounds are called the lub and the dub. But what's important to me is that you know what is causing them. The first sound, the one that we'll refer to as the lub, the first sound is caused by the closing of the bicuspid and tricuspid valves. So when you hear your heart beat, boom, boom, the first sound is when the valves between your atria and your ventricles close. Blood is going into your ventricles and it's pushed. So when your ventricles contract and push on that blood and it can't go backwards, it hits the valves as they close, and that makes a sound. So the first sound is when the valves, bicuspid and tricuspid valves, close. And they close in response to the blood being below them. Valves are not things that can think on their own. They just respond to stimuli. And those valves always close when the blood has gone through them and is now below them, let's say. The second sound, so number 1 is the lub, number 2 is the dub. The second sound is caused by the closing of your semilunar valves. Semilunar valves are the ones that attach a ventricle to an artery, either your pulmonary artery or your aorta. As blood moves through those arteries, it will start to move backwards. And when it gets to the point where the valve is, the valve closes. And that's what you get, or that's where you get the sound. The name of the tool is called a stethoscope. And so I'll pause here just for a minute. So your heart sounds are caused by blood hitting a valve and the valve closing. Now you have several illustrations of your heart that I've handed out to you or that are in your textbook. And so I'm just showing a couple of pictures down here just so you can visualize where those valves are. The first heart sound happens when blood hits the valves between your atria and your ventricles. So that's this spot and this spot. Those were hopefully the valves that you could see yesterday when you were dissecting a heart. Notice that it looks like there's those little stringy bits attached behind the valves and around the valves. So when you're trying to identify a valve on your diagram, that's what you're looking for. It looks like a little cup or a little flap of tissue, and it always looks like it has little stringy cords kind of around it, and so that's the way that you could identify it. The valves that are on your arteries are just a little bit tougher to see, which is why I don't always ask you to necessarily identify them in the lab. Your semilunar valves are these two valves here. They're both on the ends of an artery where the artery meets your ventricle. And that's where the second sound is coming from. So it would be very realistic for me on a test to show you a picture of the heart and ask you which structure makes the first heart sound, which structure makes the second heart sound. So you would need to be able to recognize visually these valves so that you could pick them out on a diagram. Now the other thing that I'd like to make sure everybody knows is that we're going to talk a lot about tools and technologies. So the first one was an electrocardiogram. A stethoscope is our next instrument. Now stethoscope is one that's fairly familiar to you. Most people don't have trouble remembering that one. But I'm pointing it out because we're going to talk about a bunch of tools as we go through this section. Would anybody like to ask any questions about your heart sounds or what's causing them? Now, usually when you listen to your heart, the way that your heartbeat goes is boom, boom, and then a space. Boom, boom, and then a space. Uh, when you hear that, and this is sometimes the misconception that people have, usually that's the end of one heartbeat and the beginning of the next heartbeat. And so I'm not going to ask you to be able to identify by sound, just by listening to it, which part of your heartbeat you're listening to. I would only ask you to recognize, if I showed you an ECG, which part of your heartbeat that was. Or if I asked you about heart sounds, which valves were associated with those sounds. Would anyone like to ask anything at all here? Does anybody need this slide to still be up yet? So one thing that I will mention is that if you happen to know that you have some sort of irregularity with your heartbeat, you don't have to tell me, but it would be interesting if you did, so that we could show people an example of a heart that beats slightly differently. Don't feel like obligated to share if you don't want to, but if that's something that you know you have, and you'd like to let other people listen to the difference in sound, that would be a cool thing to have. I'll play some sounds tomorrow for you tomorrow when we go to the lab of what different kinds of heartbeats sound like, just to give you an idea. Good. So the next thing we'll talk about is blood pressure. Now, blood pressure is a little bit trickier to measure. We have a couple of ways that we can measure blood pressure, but they all involve a thing that most people don't enjoy, the really tight cuff around your arm. We're going to use digital blood pressure cuffs so that you don't have to worry about counting and thinking about heartbeats. But the problem with those is that sometimes it doesn't get a good reading. And so we do have a couple of manual ones, but it usually takes quite a bit of practice to get good at taking someone's blood pressure with a manual blood pressure cuff. So I'll show you how they work at the very least, but we're going to use digital ones. So what's blood pressure? It's created when your ventricles contract and relax. That's what we're measuring when we measure blood pressure. How much pressure is there when your ventricles are contracting? And how much pressure is there when your ventricles are relaxing? And so what we're really measuring is we're measuring the force of blood in your blood vessels. Now you might know that when you measure blood pressure, there are two numbers that you measure. You will have higher pressure when your ventricles contract, and this is called systolic pressure. You will have lower pressure when your ventricles relax, so when they're not actually pumping, and this is called diastolic pressure. So when we're talking about blood pressure, there are a few things that I'd like to show you so you can relate it to what's happening in your heart. The two words, systolic and diastolic, represent two numbers that we would usually use to record your blood pressure. Systolic is always the higher one, and it's the one that goes on the top. During the systolic phase, what's happening is that blood pressure is increasing, and this is because in the systolic phase, your heart is contracting. And so if you notice in this picture, it's illustrating that in all of your arteries, blood is flowing from your heart into your arteries. And so the word systolic and the word start both start with S. And so when I think about this, I think that systolic is the start. It's when blood first leaves the heart. And so that picture is illustrating the aorta at the top and the pulmonary arteries on the side. And it's showing that as your heart contracts, blood is starting to flow into those vessels. And so because the blood has just entered, it's just been pushed in by the ventricle, that's why the pressure is high. Now lower pressure, which is your diastolic phase, happens when your heart is relaxed. And so I like to think about this as relating diastolic to done. When the diastolic phase is happening, your heart is done pumping the blood. And so during this phase, blood comes back in through your superior and inferior vena cava and your pulmonary vein and fills the atria up again so that your heart could once again pump blood. Now the systolic number is supposed to be higher. The diastolic number is supposed to be lower. I would never make a question where the opposite was true. So the systolic will always be the bigger number when I ask you questions. The diastolic will always be the lower number. When we record pressure, we always record it as a fraction, and the units are called millimeters of Hg, which stands for mercury. Now, if you're taking chem, or you have taken chem, you might know that that is a unit for measuring pressure. Anytime we're measuring pressure, what we're really measuring is force per unit area. So for every unit of area, how much force is being applied there. Now we could measure pressure in a bunch of different units. There are things called kilopascals that we could use. Millimeters of mercury just happens to be the one that we use for blood pressure. This is the value for an average, healthy, adult person. It's just an average. Your number could be higher or lower on either of those values, and you might still be perfectly healthy. The upper number is your systolic. The bottom number is your diastolic pressure. Something that I would definitely do is ask you not just whether it's systolic or diastolic, that's a vocabulary word, but I would ask you to relate what's happening in your heart for each of those numbers. So I might say a person's blood pressure is 120/80. What does that mean? Well, it means when their heart is contracting and blood starts to leave the ventricles and go into the arteries, the pressure is 120. And when the heart is done contracting and it's relaxing, the diastolic phase, that is when the pressure in your blood vessels is 80. Now, what influence blood pressure? Well, there are a ton of things. Amount of blood you have. So, for example, someone who has recently lost a lot of blood would probably have lower blood pressure. If you donate blood, promo here, December 3rd, I'm pretty sure is our next blood donor clinic, and if you are 17, you are allowed to donate blood. So if you are interested, you can sign up. If you can't donate blood but you'd like to help, Mr. Humphrey is always looking for people to hand out juice and cookies. Now, why do they make people who donate blood sit around and have a snack for a while? If you just gave away some of your blood, you have physically less blood in your body. That means that your blood pressure is a little bit lower, and it could cause you to, for example, faint. And so they want you to stay there, lay down, have a snack, and give your body a chance to recover. Your pulse, or the rate at which your heart is beating, is another thing that affects your blood pressure. If your heart is beating faster, that means that more often blood is being pushed through your blood vessels, so your blood pressure would be higher. Size of your arteries. Now I'll mention a very common thing that happens to people. It's the idea that the walls of your arteries start getting a buildup on them. It's called a plaque. And as you get older, or if you are doing things that are causing plaques to develop, your arteries could actually become narrower. They might even be narrower just because. So this could be a genetic condition that you already have, or this could be something that happens over time. Things like the viscosity of your blood, so how thick or thin your blood is, and that has to do with a lot of other factors, like how much water you have in your body, and how well some of your other organs work at filtering your blood. Distance from the heart. So when we measure someone's blood pressure, we measure their arm. And the reason we measure their arm is because it's relatively close to your heart. We would not measure someone's blood pressure in their foot because that is about as far away from your heart as you can get, and it would not give us as accurate of a measurement. Stress can affect your blood pressure. Now, if you have a lot of stress, what usually happens is your heart beats faster. Your diet can affect your blood pressure because it will very probably affect the size of your arteries. A diet high in cholesterol could cause buildup in your arteries, making them narrower, as well as genetic conditions. Some people are just a little more predisposed to high blood pressure than others, and even if it doesn't seem like they are doing anything, their blood pressure may be high. So there are things that you can do, in terms of diet and exercise, but as well things that you can do in terms of medication to reduce your blood pressure. Now, what is the name of the tool? It is called a sphygmomanometer. A sphygmomanometer. It's most commonly called a blood pressure cuff, but that is the technical name. Sphygmomanometer. Sphygmomanometer. And that's the name of the tool. I put a picture of it here so that you can recognize it. When you're taking someone's blood pressure, you need to record their pulse as well as the pressure. So usually a sphygmomanometer will be used in combination with a stethoscope so that you can hear the person's heart beating as well as record the pressure. On the digital blood pressure cuff, it does both things for you. Does anyone have any questions they'd like to ask about blood pressure here? So the other things are just a little bit simpler. Cardiac output pulse. Your cardiac output is a measure of the amount of blood. So literally, how many milliliters, what volume of blood is coming out of your heart in a certain interval of time. And so if I were to take an average, and these averages are always for healthy adult people, and so sometimes when we measure things in class it seems a bit off because you guys are all still growing. But the average heart pumps out about 70 milliliters of blood each beat. Now this is the volume of blood that is coming from the left ventricle and going to your body tissues. Now your pulse is simply a surge of blood through an artery that you can feel, and it happens when your left ventricle contracts and sends blood through your body tissues.